Hello, in this video, let us look at another anatomy final exam question asked for 5 marks here is Palmar aponeurosis. So we are talking about your palm and some aponeurosis, that means a flattened tendon. Aponeurosis is nothing but what? Flattened tendon. Okay, so here we are. This is your palm, and in the palm below your skin, what do you have? Superficial fascia. Below the superficial fascia, what do you have? Deep fascia. That is nothing but your palmar aponeurosis, and all of them are attached to each other. So what did I say? There is skin. So what do you have? Let me choose a pink for skin. So you have skin. Under that you have what? Superficial fascia. Under that you have deep fascia. This deep fascia is nothing but your palmar aponeurosis. Okay, and these are so bound to each other that the skin is immovable over your palm. Just move it and see. Immovable over your palm. So this is the where are we are talking about palmar aponeurosis. So where does palmar aponeurosis come? Here. Okay, so if you remove layer by layer, remove your skin, then you'll get superficial fascia. Remove the superficial fascia, then you should get the palmar aponeurosis, under which there are a lot of structures, blood vessels, nerves, etc. Okay, so what is palmar aponeurosis? It is the central part of the deep fascia of the palm. Deep fascia is there everywhere. That central part is the palmar aponeurosis, which what and all does it cover? It covers a lot of things like blood vessels, tendons, nerves, all that we will come to later. First of all, what is palmar aponeurosis? We are trying to define. It is part of deep fascia. Which part of deep fascia? The central part of deep fascia that you remember. Okay. It is triangular in shape. Obviously, you can see that. Okay. And then what and all does it have? Apex. So let us see. Triangle, no. So first we will check what and all is there here. So you have a base, you have an apex. Apex is continuous with some tendon, which is the palmaris longus muscles tendon. Okay, then you have, this is lateral, right? Lateral thumb side is lateral border, and here you have medial border. Something like this you can say. Medial side and lateral side. Okay, so it is triangular in shape. What else should we check here? So the apex blends with the flexor retinaculum, which is there here, right? Apex blends with flexor retinaculum, and it is continuous with the tendon of the palmaris longus. Okay, what they are saying is this is a part of deep fascia. They are not saying that it is the part of the tendon. But aponeurosis is a word used for flattened tendon, is what the textbook says. Okay. So now what are we talking about, guys, in this video? Palmar aponeurosis. If they had asked only aponeurosis, you can say it's a general anatomy topic, but they're asking you palmar aponeurosis, so you can say it is a topic of upper limb. Okay, so what is the function? It fixes the skin of the palm and thus improves your grip. So when you hold something, just hold something in front of you and see if your palmar aponeurosis helps you hold it. Okay, it also protects the underlying what? Underlying tendon, vessels and nerves. Only these three things are there under it. Okay, so it is also going to protect. So fixes the skin, improves the grip, protects the underlying structures. Who is doing all this? Aponeurosis. I can't believe it. Okay, deep fascia. It's a central part of the deep fascia. Okay, so again we are looking at palmar aponeurosis. That means of your palm. Similarly, you have plantar aponeurosis in the leg. Wait, I'll show you. Just for you to understand, I'm telling you. 1 second, I'll show you. Plantar. See, like this, you have plantar aponeurosis also. Okay. Very similar, right? Obviously. But anyways, what have they asked in this exam? In this exam for 5 marks, they have asked palmar aponeurosis. Okay. So same thing only they have, I'm trying to say again, skin is there. Below that superficial fascia is there, which is very bound to the skin. And then you have the deep fascia, which is the palmar aponeurosis, the central part. All of them are so bound to each other that the skin doesn't move over your palm. Shall we go a little more in deep, because they've asked for 5 marks, right? So which is that muscles tendon they said that it will continue as? That is the palmaris longus. Let's check if it is that only. Oh yeah, it is. See, I just found out what palmaris longus here by this label. And yes, it is the forming, the tendon is going and it is merging with what? With the flexor retinaculum, and then it is continuing as what? The deep fascia, and that's the flattened tendon aponeurosis. Everything mixed only I'm feeling. So we told you that there is a base an apex, right? So about the base, let's read more. See, apex we told you. Apex, what did we tell you? Flexor retinaculum and palmaris longus tendon. That much we told you. Base, let us focus on base now. So what you have to draw is, in the exam, you have to draw to get marks, right? So let's draw it like this, and like this, and like this, and like this, and like this, like this. Just decorate it some more, okay? So the base, what is there in base? 4 longitudinal slips at the base of each digit like this, right? And each of these longitudinal things divide again into 2, something like this. This is what you have to explain. That's more than enough if you explain this at the base of each digit, okay? Over, no? This much is enough, I feel. Okay, so let's go to the medial and lateral border in this one. So medial border is where here. Medial border, what they are saying, hypothenar muscles. So there is some, the aponeurosis, the deep fascia part continues to cover the hypothenar muscles. And what do you have in the lateral border side? You have the thenar muscles that also is covered by that deep fascia. Okay. Guys, now let us go to the last part. What should you write? As the last part of every question, you have to write clinical importance. Why are we learning this? Clinical anatomy. Okay. So for that, you can explain Dupuytren's contracture. First, you learn the spelling of Dupuytren's. Dupuytren. Dupuytren. But what are you going to say? Dupuytren's contracture. Very good. Okay. So now let us look at Dupuytren's contracture. Where did it go? Here. So Dupuytren's contracture, what is happening? Who is affected? Palmar aponeurosis. How is it affected? Inflammation. What is the actual condition here that is happening? You won't even believe it's the inflammation. They didn't give the cause of this inflammation, but it's inflammation of this Palmar aponeurosis, because of which this Palmar aponeurosis, you can see, is becoming thick. And what? It is becoming shortened. The contracture is happening. So what is happening? Your finger, especially the ring finger, it is flexed. You cannot straighten it. That's what they are saying. Okay, especially the ring finger. So when you wear a ring, you can keep showing it to everybody, right? Like that. You're always flexing the finger kind of a thing. And everybody can see, oh, there's a ring on this finger, ring finger. So that is Dupuytren's. Dupuytren's contracture. Okay. So what else? This is Dupuytren's contracture. Okay, this is more than enough. Also in burns of hand, you should be careful, because burns of hand, you will think that, okay, fine, I just burnt my hand, and then you'll put so many things. But over the time, there'll be contractures of your hand, and hand is a very important thing for you, isn't it? So obviously, you should be very careful about these things, okay? See guys, one thing we forgot is to cover is the structures under the Palmar aponeurosis, right? So what do you have? First, you remove the skin. Under the skin, you remove superficial fascia. Under the superficial fascia, you have the deep fascia or the Palmar aponeurosis. Under it, what will all you will see? So under it, what and all you will see? You will see the some blood vessels. That is superficial Palmar arch mainly, remember. Then you will see some tendons, flexor tendons mainly. You remember which tendons? Flexor tendons, okay. And then you will also have some nerves. Which nerve? Median nerve. Ulnar nerve. So what and all did you see? Structures under the Palmar aponeurosis, superficial Palmar arch, flexor tendons, median nerve, ulnar nerve. Okay. Median nerve, ulnar nerve, you say the distal part of it, kind of a thing. Okay. Because they run from your shoulder joint till here. So just say that it is a distal part of these nerves. Okay. So if they ask for 3 marks, then you will know how much to write, right? Condense this and write. But for 5 marks, you have to write everything that we have told in this video. Bye bye.